Oh, dental hygiene is important. And a lot of, again, dental disease in pets is just like you or I. And a big component of how healthy our teeth are is genetic. So if Grammy and Grandpa had good teeth, you're in good shape. If they were cursed, you might be a bit cursed too. And the same happens in the pet world. And we tend to see, not always, but tend to see more dental disease in young, I'm sorry, excuse me, smaller dogs than we do in the bigger ones. That's not universally true, but pretty generally that is true. And what do we do about it? Well, we evaluate the pets and see what happens. Most of them are probably seeing their veterinarian once a year, twice a year, or at least every couple of years for vaccines and those kind of issues. And that's a good time for the veterinarian to look at their teeth and see how they're doing. Certainly in dogs that have significant dental problems, brushing their teeth daily is good for them. You know, when we use a doggy toothbrush and doggy toothpaste, because we don't want them swallowing all the fluoride and everything that is in our toothpaste, so we use those. And then cleaning, it all depends on the dog. Some dogs might have their teeth cleaned once or twice in their life. Other dogs would have their teeth cleaned every 6 months and end up losing multiple teeth, and it certainly can be problematic for them. Let's see, so, you know, controversy always is, do they have to be put under anesthesia to have their teeth cleaned? And the answer to that is generally yes, unless the risk of anesthesia is so great that we say it's the potential benefit from dealing with their teeth does not warrant the risk of anesthesia. But, you know, no guarantees with anesthesia, but nowadays we examine pets before they go under, listen to their hearts. We do blood tests, look at their liver and kidney function. We probably have as many monitors on pets under anesthesia nowadays as they do on you or I if we were under. So we know what their blood oxygen is. We know what their heart rate is. We know what their breathing rate is. We can see their EKG and make sure it is a normal rhythm. You know, and all these elaborate machines, if we did not notice it, which we would because we're watching, have alarms set up. So under certain circumstances, if we haven't addressed something, they call our attention to it. So in a nutshell, we would say that if a pet really needs their teeth cleaned, probably the risk of not addressing that is greater than the risk of anesthesia. And if I may add one more thing, why do we do that? Because when we look at our pet's teeth, we can see the tartar on their teeth if we look closely, but that cosmetic tartar that we see on the teeth is unpleasant and may be producing an odor, but the real problem is up underneath the gums. And that's like when you and I have our teeth cleaned and the hygienist is up there kind of getting up underneath the gums and getting that plaque and tartar out of there. That's the real problem, and we will sit there and cooperate with them, but certainly dogs find it a bit unpleasant, and I think in the vast majority of the cases it's hard to do an adequate job without anesthetizing them, but you need to evaluate the risk of anesthesia and make a good decision about that.
Absolutely. Thank you so much. So is once a day brushing good enough?
Once a day?
Yeah.
Yeah, you know, that's kind of standard, you know, and once a day would be best for most pets. And it's one of those things too, we introduce it to our pets slowly, try to make them see it as an enjoyable time to interact with, you know, their owners, and they're rewarded for it. And we want to make it a pleasant experience for them, not, you know, an ordeal they have to go through. And they make toothbrushes and flavored toothpastes and all of that. And I think in the vast majority of pets, if we introduce them to it, they tolerate it and don't mind. There certainly are those where it just is not going to happen, that's for sure. But most of the time, Yes, and once a day is the standard frequency we would recommend.
That's perfect. I'm gonna see what time it is. Do you need to go? Oh, you do.
I'm good. If you
You
have
need to
more
go for
questions,
lunch.
so if you have more questions, we have a bit more time.
Yeah.
Oh, sure. I'll kind of open it up to anybody who have a question. I have one more question regarding teeth brushing, and if dental tubes are the same as toothbrushing or say as substitutes.
I think there's a lot of different things you can do to help keep teeth healthy. And certainly one, we go back to nutrition. A good diet, like for everything in our bodies, is important. They make these dental diets for dogs and cats, and basically they're just a larger kibble that when the dogs or cats bite into those, have enough of a abrasive action that they can remove some of that tartar. That works well, and then otherwise, I'm afraid that like most things in life, the harder things work better. If we want to take care of our teeth, we have to brush our teeth and floss our teeth. So we have to go that extra step. If the floor is dirty, you can sweep it, but really scrubbing it is really what gets it clean. And the same is true with teeth. I think that dental brushing is the most important. Certainly dental chews work to some degree, oral rinses work to some degree, but like with us, you just have to somehow mechanically get that debris off the teeth, and the toothbrush is the best way to do it.
Yeah, absolutely. That's really good tools. You can use them, but it doesn't substitute out actual teeth.
We're reading a question on the bottom here that says, "Can you speak about papilloma and how long till it goes away?" Did you see that question pop up? I guess from papilloma, it depends on what exactly we're talking about. And papilloma is just a benign tumor. And again, we're talking dogs here, maybe not cats, because dogs get a lot of lumps and bumps, and most of them are benign. Cats don't get many lumps and bumps, and a lot of those are more serious. But traditionally, we would think about a papilloma as being a benign lump. Dogs do get what we call viral papillomas on their mouth and tongue and in their oral cavity. And often, technically speaking, we always say without a tissue sample and somebody looking at it under the microscope, we can't say with great confidence exactly what it is. But a lot of times we can look at those and say, it's very likely that's a papilloma. A lot of these viral papillomas in younger dogs eventually resolve on their own. Other types of skin growths and those kind of things, we tend to watch them, evaluate them, and just stop and think about what is, how angry does that look? I mean, does it look like a little benign growth, or is it getting to look like a growth that we should take more seriously? And a growth we take seriously grows rapidly, the surface ulcerates, it bleeds, it's painful, and we look for those kind of things, and those lumps we move in and address much more quickly. And then also we can do what's called cytology. We can put a needle into a lump, collect cells from it, and often get a good indication of what it is.
Okay, that's good. I don't know if you have answered the question.
One more. This could be the last one.
I see one last one. It is talking about long-term anxiety medication and behavioral and environmental adjustments. And that's something we deal with a lot. And back in the very beginning, we talked a bit about what is the basic important things for our pets' health. And a lot of that is socialization. So we like to get pets when they're young and socialize them so they're happy around other pets, they're happy around, men, women, children, all those kind of things. So we want them adjusting to all that. We want them to be able to go to the park, go to Dog Beach and behave normally and not find it an anxiety-inducing situation. There are any of a number of anti-anxiety medications we use in dogs nowadays, and it's not uncommon in what we kind of call a fear-free practice like we have here to give dogs or cats medication like trazodone or gabapentin before they come in, just to cut down on their anxiety level so it's not too much of an ordeal for them. We can look at them and make it as pleasant an experience as possible. There certainly are other dogs that have more major anxiety problems, and literally some of those dogs end up on Prozac, Xanax, and much more potent anti-anxiety medications. But what was good about that question is, and we would commonly, if a pet had that degree of anxiety, we would send them to a veterinary behaviorist, and we have a couple of those here in San Diego. And our goal behind that is not to take somebody's pet and put them on lifelong medication. Our goal is to deal with their immediate discomfort with some type of medication and then introduce some kind of training, behavioral modification protocols or regimes so that we can eventually get that pet comfortable in those situations and take them off the medication, because nobody wants to be on medication forever.
Perfect. Thank you so much for being today. Thank you for answering these questions. Anybody free to reach out to you with any more questions?
Yeah, absolutely. They can call us, contact us. And thank you for, I think FIDUS is doing a terrific job. It's a newer idea and working well, and it's been fun to do this today.
Thank you so much. We hope to have you back again one day.
All righty. Thank you.
Bye.
I'm gonna try to see.
All right, everyone, thank you so much for watching. I apologize on my end if there were some internet issues. Again, I did have some here at FIDUS today. I don't know why. It seemed to only happen when I had another person here. But thank you so much for joining in today. Today, I was really looking forward to having a veterinarian here. We had some great questions, not only pre-prepared, but also you guys had really great questions, and the vet is here for you guys. If you have any more, please feel free to reach out to them. His name is Dr. Woods. My name is Jasmine. I am the general manager here at FIDUS. If you have any other questions that maybe we couldn't address today, I do plan on having him come back, or another veterinarian. There are quite a few that we work with, and we will make sure to answer those questions. So again, thank you so much for joining in today. I will be back on Friday. We're going to have another really fun episode of some DIY dog puzzles that I've talked about quite a few times. And I hope that everybody learned something today. And if you have any more questions, feel free to reach out. Our phone number is 858-925-6152. You can email us at concierge@fiduspet.com. And if not, thank you for joining. I will see you guys on Friday at 1 p.m. Pacific Standard Time with another really fun DIY dog puzzles. Thank you so much for watching. Bye.